Daily Vite is a multivitamin product that helps to treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins are essential for the body and help to maintain good health. It is recommended to take Daily Vite once a day, preferably with a meal to maximize absorption. Taking it in the morning with breakfast is often the best time. The benefits of Daily Vite include providing essential vitamins and minerals that may be lacking in your diet, supporting overall health and well-being. When it comes to taking Daily Vite, it's important to follow the instructions provided. Typically, you'll take this medication by mouth, usually once a day or as directed by your doctor. It's crucial to follow all the directions on the product package or as instructed by your healthcare provider. It's important not to exceed the recommended dosage. If you have any questions or concerns, be sure to ask your doctor or pharmacist for guidance. In order to get the most benefit from Daily Vite, it's important to take it regularly. To help you remember, try to take it at the same time each day. This consistency can help ensure that you're getting the most out of this medication. Remember, always follow your doctor's instructions regarding the dosage and timing of Daily Vite. Some common side effects of taking Daily Vite include constipation, diarrhea, or an upset stomach. These effects are usually temporary and may go away as your body gets used to the medication. However, if these effects persist or worsen, it's important to consult your doctor or pharmacist. If your doctor has prescribed Daily Vite, they have determined that the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. While it's rare, a very serious allergic reaction to Daily Vite can occur. Seek medical help immediately if you experience symptoms such as rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of potential side effects. If you experience any other effects not mentioned here, be sure to contact your doctor or pharmacist. As always, if you have concerns about the side effects of Daily Vite, don't hesitate to reach out to your doctor for medical advice. It's important to keep multivitamins containing iron out of reach of children, as accidental overdose of iron-containing products is a leading cause of fatal poisoning in children under 6 years old. If an overdose does occur, seek medical help immediately or call a poison control center. It's important to talk to your doctor or pharmacist before taking Daily Vite if you have any allergies to its ingredients, soy, or peanuts, or if you have a history of alcohol abuse, liver problems, or stomach/intestinal problems. If your Daily Vite contains folic acid, let your doctor know if you have a vitamin B12 deficiency before taking it, as folic acid may affect certain lab tests for vitamin B12 deficiency. It's also important to inform your doctor about all the medications and herbal products you are using before having surgery. If you are pregnant or breastfeeding, consult your doctor before using Daily Vite. It's important to be aware of potential drug interactions when taking Daily Vite. It's possible that this medication could affect the way other medications work or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, and share it with your doctor and pharmacist. Don't make any changes to your medication dosage without your doctor's approval. If your multivitamin contains iron, it's best to avoid taking it at the same time as antacids, bisphosphonates, levodopa, thyroid medications, or certain antibiotics. Ask your doctor or pharmacist how long you should wait between doses and for help finding a dosing schedule that works with all your medications. If your multivitamin contains folic acid, be sure to inform your doctor or pharmacist if you take certain anti-seizure drugs. It's important to note that Daily Vite may interfere with certain lab tests, which could result in false test results. Make sure to inform lab personnel and all your doctors that you are using this medication. If someone has taken too much Daily Vite and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. Always seek medical attention if you suspect an overdose. It's important to keep all your medical and lab appointments when taking Daily Vite. Some brands of Daily Vite may also contain ingredients like docusate. If you have any questions about the ingredients in your specific brand, it's best to ask your doctor or pharmacist. Remember, daily Vite is not a replacement for a healthy diet. It's best to get your vitamins from nutritious foods and maintain a well-balanced diet. Make sure to follow any dietary guidelines given to you by your doctor. If you forget to take daily Vite at your usual time, take it as soon as you remember. If it's almost time for your next dose, then just wait and take your next dose at the regular time. Don't take extra doses to make up for the missed one. When it comes to storing daily Vite, it's important to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom, and be sure to keep it out of reach of children and pets. When it comes to proper disposal, it's important not to flush daily Vite down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to discard the product properly when it is expired or no longer needed. If you're unsure about how to dispose of daily Vite, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.